You wake up in the morning. The sun is just coming through the window, and the very first thing you notice, before you even sit up in bed, is that your mouth feels like you've been chewing on sandpaper all night long. Your tongue is sticking to the roof of your mouth. Your lips feel cracked and dry, and you reach for that glass of water on your nightstand before you do anything else. Sound familiar? Most people over 60 just shrug it off. They think, oh, it's just how it is when you get older. It's nothing to worry about. But here's what your doctor may not have told you yet, and what a growing number of medical specialists are now warning about. Waking up with a dry mouth every single morning is not a normal part of aging. In fact, it could be a quiet, almost invisible signal that something much more serious is happening inside your body. And today, we are going to talk about exactly what that is. Because this is one health warning that too many seniors are ignoring, and it could be costing them their quality of life. Welcome back. And if you are new here, welcome. This channel is dedicated to bringing you real, honest, and helpful health information designed specifically for people over 60 and the families who love them. Today's topic affects an estimated 30% of adults over the age of 65. And yet, it barely gets talked about at the doctor's office. We are talking about chronic morning dry mouth, a condition doctors call xerostomia. And more importantly, we are talking about the silent, hidden causes behind it. Causes that go far beyond just sleeping with your mouth open or not drinking enough water. Because here is the truth. If you are over 60 and you are waking up with a dry mouth almost every morning, your body might be trying to tell you something important. By the end of this video, you will understand why dry mouth happens more in seniors, and why age alone is not the real answer. You will learn the surprising and sometimes serious medical causes that doctors are now linking to chronic dry mouth. You will know what symptoms to watch for, including ones that seem completely unrelated, and you will have practical steps you can start taking today to protect your health. So please, stay with us. This one is important. First, let us make sure we understand what we are actually talking about. Dry mouth, or xerostomia, is the feeling that there simply is not enough saliva in your mouth. Your mouth feels dry, sticky, or uncomfortably parched. You might wake up with a sore throat, bad breath, difficulty swallowing, or even a rough, uncomfortable sensation on your tongue. Now, everyone gets a slightly dry mouth occasionally. Maybe you slept with the air conditioning running all night. Maybe you had a long and restless sleep. That is totally normal. But we are talking about something different here. We are talking about waking up with a dry mouth almost every morning, consistently, regularly, day after day. And here is where it becomes especially important for seniors. Saliva is not just about keeping your mouth comfortable. Saliva is actually one of your body's most important protective tools. It protects your teeth from decay and harmful bacteria. It fights off infections in the mouth and throat. It helps you taste and swallow food properly. It contains enzymes that actually begin the digestion of food the moment you take a bite. And it even helps protect the lining of your esophagus, the tube that connects your mouth to your stomach. When your body is not making enough saliva, especially overnight, all of those protective functions start to break down. And for older adults, the consequences can be far more serious than most people realize. So why does this happen more in people over 60? Yes, as we age, our salivary glands do naturally produce a little less saliva. That is true, but doctors are very clear on this point. Age alone should not cause severe, uncomfortable morning dry mouth. When it is happening regularly, when it is waking you up or affecting your mornings consistently, there is almost always a deeper reason behind it. And that is exactly what we are going to explore right now. This next section is the heart of today's video. And I really want you to pay close attention because some of these causes may genuinely surprise you. The first cause, and possibly the most common one, is your medications. If you are over 60 and taking any prescription medications, and most Americans in their 60s, 70s, and beyond are taking at least one, this is the number one thing your doctor wants you to know. More than 500 commonly prescribed medications list dry mouth as a side effect. 500, and the medications most likely to cause this problem? Many of them are medications that seniors take every single day, blood pressure medications, especially diuretics, which are sometimes called water pills and beta blockers, antidepressants and anti-anxiety medications, antihistamines. Yes, the allergy pills that many seniors take regularly without a second thought. Medications for overactive bladder, cholesterol-lowering medications, and certain pain medications, including some that are available over the counter. Here is what makes this especially tricky for seniors. Many older adults are taking multiple medications at the same time. Doctors call this polypharmacy, and when you combine several medications that each cause mild dry mouth on their own, the effect can become much more significant, much more uncomfortable, and much harder to ignore. Many seniors never make this connection. They do not realize that the dry mouth they wake up with every morning is directly linked to the pills they take every evening. Here is what you should do. Write down every single medication you take, including supplements and any over-the-counter drugs. Bring that list to your next doctor's appointment and ask specifically, could any of these be causing my dry mouth? You may be surprised by the answer, and sometimes simply adjusting the timing of a dose, changing the dosage, or switching to an alternative medication can make a dramatic difference in how you feel every morning. The second cause is sleep apnea, and this one affects millions of seniors who have no idea they have it. Sleep apnea is a condition where your breathing repeatedly stops and starts while you sleep, and one of its most telltale morning symptoms is waking up with a severely dry, parched mouth. Here is why this happens. When your airway is partially blocked during sleep, your body automatically opens your mouth to try to get more air. You end up breathing through your mouth all night long without even realizing it. The saliva in your mouth evaporates as air passes over it, and you wake up feeling like you have not had a single drop of water in days. But here is the part that makes this more than just an inconvenience. Sleep apnea is not just about dry mouth and snoring. It is linked to a significantly higher risk of heart disease and heart attacks, stroke, high blood pressure, type 2 diabetes, and memory problems and cognitive decline. And here is something that many people, including many doctors, do not always consider. You can have sleep apnea without snoring loudly. Many seniors, especially women, experience what is called silent sleep apnea. No dramatic snoring, no obvious gasping in the night, just persistent morning dry mouth, unexplained fatigue, and waking up feeling like the sleep you got did not actually rest you. Ask yourself these questions. Does your partner ever mention that your breathing sounds unusual while you sleep? Do you wake up with headaches in the morning? Do you feel exhausted even after spending a full 8 hours in bed? If any of that sounds familiar, please talk to your doctor. A sleep study can detect sleep apnea clearly and accurately. And treatment, which is often as simple as a small breathing device worn at night, can be genuinely life-changing. The third cause is dehydration, but not the kind most people think about. Most people associate dehydration with exercising in the summer heat or forgetting to drink water during a busy day. But here is something critically important about the aging body that many people are never told. As we get older, our sense of thirst actually decreases. Your body stops sending those strong, reliable signals to drink water the way it did when you were younger. This means that many seniors are walking around in a state of mild chronic dehydration, not dramatically thirsty, not feeling obviously sick, just quietly, slowly, not getting enough fluids throughout the day. And overnight, when you are not drinking anything for 6 to 8 hours, that mild dehydration becomes more pronounced. The result is dry mouth in the morning, and this matters deeply because dehydration in older adults is linked to urinary tract infections, kidney problems, confusion and cognitive difficulties, constipation, and an increased risk of falls and dangerous dizziness. Here is a simple tip you can start tonight. Before you go to bed, place a large glass of water on your nightstand. And when you wake up tomorrow morning, before you check your phone, before you turn on the television, drink that glass of water. Also, try drinking a glass with each meal throughout the day. And if you find it hard to remember, set a gentle reminder on your phone or leave a note somewhere visible. Small habits like this can make a real and meaningful difference. The fourth cause is one that doctors specifically urge seniors not to overlook, and that is diabetes. Persistent dry mouth is one of the lesser known but very real warning signs of type 2 diabetes and prediabetes. Here is what happens inside the body. When blood sugar levels are elevated, as they are in diabetes and prediabetes, the kidneys work overtime trying to filter out the excess glucose from the blood. This causes the body to produce more urine. More urine means more fluid loss. More fluid loss leads to dehydration, and dehydration leads directly to dry mouth. On top of that, elevated blood sugar can directly affect the salivary glands themselves, reducing the amount of saliva they are able to produce. Now here is what makes this especially concerning. Many older Americans have type 2 diabetes or prediabetes and do not know it. According to the Centers for Disease Control and Prevention, the CDC, roughly 96 million American adults have prediabetes, and more than 80% of them are completely unaware of it. So if you are waking up with dry mouth regularly, pay attention to whether you are also experiencing increased thirst throughout the day, frequent urination, especially at night, unexplained tiredness or fatigue, blurry vision, slow healing cuts or wounds, or tingling and numbness in your feet or hands. If you are experiencing dry mouth along with any of those symptoms, please make an appointment with your doctor and ask for a blood sugar test. It is a simple blood test. It takes just a few minutes, and catching diabetes or prediabetes early can make an enormous difference in your long-term health and quality of life. Now, I want to stop here for just a moment, because I know that some of you watching this right now are recognizing things I have just described. Maybe you have been brushing off that morning dry mouth for months, maybe even for years. Maybe you are watching this because you are worried about an elderly parent or a spouse who keeps complaining about waking up with a dry mouth, and you have not known what to make of it. If you are over 60, or if you are caring for an elderly loved one, the information in this video could genuinely be life-saving. Please do not scroll past this. Please do not wait until things get worse. These are the kinds of signs that get dismissed for too long, and early attention truly can make all the difference. If this video is helping you so far, please take a second right now and hit the like button. It helps us reach more seniors across the country who need this information. And keep watching, because we still have more important causes to cover. The fifth cause is a condition called Sjogren's syndrome, and most seniors have never heard of it. Sjogren's syndrome, pronounced Sjogren's, is an autoimmune condition. That means it is a condition where the body's own immune system mistakenly attacks its own tissues. In the case of Sjogren's, the immune system attacks the glands that produce moisture, including the salivary glands and the tear glands. The result is significantly reduced saliva production and reduced tear production. Symptoms include dry eyes that feel gritty or constantly irritated, persistent dry mouth, especially pronounced in the morning, difficulty chewing or swallowing dry foods like bread or crackers, dry skin, or a persistently dry nasal passage, and extreme unexplained fatigue. Sjogren's syndrome affects an estimated 4 million Americans, and it is significantly more common in women over the age of 40, with many cases not being diagnosed until a person is well into their 60s or even 70s. Many people with this condition spend years, sometimes decades, assuming their dry mouth and dry eyes are simply a normal part of getting older, not realizing that it is actually a diagnosable and treatable medical condition. If you have persistent dry mouth along with consistently dry and irritated eyes, please bring both of those symptoms up with your doctor together. A specialist called a rheumatologist can test for Sjogren's syndrome, and there are treatments available that can genuinely and meaningfully improve your quality of life. The sixth cause applies to seniors who have undergone radiation therapy, particularly for cancers of the head or neck. Radiation to the head and neck area can damage the salivary glands, sometimes significantly reducing their ability to produce saliva. This is a side effect that does not always get discussed thoroughly with patients before or during treatment, and many cancer survivors are left managing severe chronic dry mouth for years afterward without knowing there is support available. If you or a loved one has been through cancer treatment and is now living with persistent dry mouth, please know this. There are specialized treatments, saliva substitutes, oral rinses, and mouth care protocols specifically designed to help. Ask your oncologist or your dentist specifically about dry mouth management. You do not have to simply accept it as something you must live with forever. The seventh cause involves the nervous system, and this one is particularly important for seniors and their families to understand. Certain neurological conditions can affect the nerves that control saliva production and the automatic act of swallowing. Conditions like Parkinson's disease, Alzheimer's disease, and certain types of stroke damage can all interfere with the body's ability to properly regulate saliva flow. And importantly, if dry mouth is occurring alongside other neurological symptoms, such as tremors, difficulty with balance, noticeable memory changes, or alterations in speech, this combination of symptoms is something that should be discussed with a doctor as soon as possible. These are not signs to wait and see about. They are signs that deserve prompt and careful medical attention. Now let us talk about what you can actually do, because knowledge matters, but action is what protects your health. The first and most important step is to talk to your doctor, and do not wait. If you have been waking up with a dry mouth regularly, bring it up at your very next appointment. Do not assume it is just aging. Do not brush it off. Ask your doctor to review all of your medications. Ask about checking your blood sugar levels. And if there is any possibility of sleep apnea, ask about a sleep study. Write your symptoms down before your appointment so you do not forget anything in the moment. Doctors appreciate specifics. How long has it been happening? How often? How severe? And what other symptoms come with it? The second step is to stay hydrated, consistently and intentionally. Aim for at least 6 to 8 glasses of water every day. And remember, because your sense of thirst may not always remind you, build a simple routine around it. A glass of water when you wake up. A glass with every meal. A glass in the afternoon. A small glass before bed. Limit caffeine and alcohol, especially in the evening hours. Both contribute to dehydration and will make dry mouth noticeably worse. The third step is to breathe through your nose and get help if you struggle to do so. Mouth breathing at night is one of the most direct causes of morning dry mouth. If you find yourself consistently breathing through your mouth because of congestion, allergies, or a structural issue in your nasal passage, talk to your doctor. A simple nasal rinse, an allergy treatment, or even a nasal strip worn at night can sometimes make a significant difference. And again, if sleep apnea is suspected, please get tested. It is a treatable condition, and treating it can protect far more than just your mouth. The fourth step is to protect your teeth and practice good oral hygiene, especially before bed. Dry mouth significantly increases your risk of tooth decay and gum disease. Brush at least twice a day using a fluoride toothpaste. Use an alcohol-free mouthwash. Alcohol-based mouthwashes can actually worsen dry mouth, so check the label. Consider using a dry mouth gel or spray at bedtime. These are available over the counter at most pharmacies and can provide gentle relief through the night. And visit your dentist at least twice a year, making sure they know about your dry mouth. Your dentist can be a powerful partner in helping you manage this. The fifth step is to use a humidifier in your bedroom. If the air in your sleeping space is dry, especially during winter months or when air conditioning is running, a small bedside humidifier can add moisture to the air and help prevent your saliva from evaporating while you sleep. It is a simple, inexpensive change that many seniors find makes a noticeable difference by morning. The sixth step is to be mindful of what you eat and drink. Certain things make dry mouth worse. Salty, spicy, or very acidic foods, caffeinated beverages, and alcohol. Instead, lean toward water-rich fruits and vegetables. Cucumbers, watermelon, and celery are wonderful choices. Warm broths and soups are both hydrating and gentle on a dry mouth. And sugar-free gum or sugar-free hard candies are a well-known trick for stimulating saliva production during the day, without adding sugar that could harm your teeth. Now, before we wrap up, there are some warning signs I want to make sure you know about. Because while most causes of morning dry mouth are manageable and treatable, some symptoms mean you should contact a doctor sooner rather than later. Please seek prompt medical attention if your dry mouth is accompanied by extreme, unquenchable thirst that lasts all day, sudden or significant weight loss without any change in diet, blurry vision or other vision changes, difficulty swallowing that is gradually getting worse, swollen glands or unusual lumps in the neck or face area, persistent bad breath that does not improve with brushing, tingling or numbness in your hands or feet, or noticeable confusion and memory changes. These symptoms, alongside chronic dry mouth, could point to conditions that need careful and timely evaluation. Please do not wait on these. Please do not ignore them. Let us bring everything together now. Waking up with a dry mouth might seem like a minor inconvenience, something easy to brush off, something easy to explain away. But as we have learned today, for people over 60, it can be the body's quiet, persistent way of raising a red flag. It could be your medications. More than 500 common drugs list dry mouth as a side effect. It could be sleep apnea, a serious but very treatable condition affecting millions of seniors who do not know they have it. It could be mild chronic dehydration, made worse by the fact that our sense of thirst naturally decreases as we age. It could be an early warning sign of diabetes or prediabetes, conditions that affect tens of millions of Americans who are unaware. It could be Sjogren's syndrome, an autoimmune condition that is far more common than most people know. It could be a lasting effect of cancer treatment, one that can be actively managed with the right support, or it could be connected to a neurological condition that deserves prompt medical attention. The bottom line is this: you know your body, you know what feels normal and what does not. And if something has been bothering you, even something that seems as small and ordinary as a dry mouth every morning, you deserve to have it taken seriously. Because often, what seems small on the surface is your body's way of asking for attention before something bigger has the chance to develop. Do not ignore the quiet signals. Do not brush off the early warnings. You matter. Your health matters. And the people who love you need you to take care of yourself. Before you go, I have a few simple requests. If this video gave you helpful information or made you think differently about a symptom you have been living with, please hit the like button right now. It truly helps us reach more seniors across the country who need to hear this. If you have not subscribed yet, please do. We publish new videos every week focused on health, wellness, and quality of life specifically for people over 60. There is so much more helpful content coming your way. And please, share this video. Think about someone in your life who might be dealing with morning dry mouth and does not know why. A parent, a spouse, a close friend, a neighbor. Sharing this video with them takes less than 30 seconds and could genuinely make a difference in their health. Finally, leave a comment below. Have you been experiencing chronic morning dry mouth? Did you ever find out what was causing it? Or did something in this video make you think about a symptom in a new way? Your comments help other seniors in our community feel less alone, and they help us create better, more helpful content for you. Thank you so much for watching. Please take good care of yourself, and we will see you in the next one.